Pneumococcal Conjugate Vaccine Impact Study in Mongolia documentary. Ulaanbaatar, capital city of Mongolia. Children aged 2 to 59 months who were hospitalized with pneumonia that met the study case criteria in selected research hospitals were included in the study. Parents or caregivers were required to give written consent for study participation. Nasopharyngeal swabs, blood samples, and chest X-rays were taken from the children enrolled in the study, and data on risk factors for pneumonia were collected and analyzed. These key interventions were the main objectives of the research units. Mongolia is a country located in the highlands of Central Asia, with 4 seasons and a dry, cold, temperate climate. Climatic conditions and high levels of outdoor and indoor air pollution continue to be risk factors for respiratory disease. In this developing country with a high birth rate and a relatively young population, respiratory diseases were the second leading cause of hospitalization and death among young children. This was the main reason for initiating the evaluation of the impact of the introduction of pneumococcal conjugate vaccine study in Mongolia. When the government of Mongolia and the Ministry of Health decide to introduce any new vaccine, the decision is based on evidence such as results from economic, clinical, and epidemiological evaluations of the vaccine, the burden of disease, and the safety and effectiveness of the vaccine. The significance of this PCV impact study is to determine the predominant pneumococcal serotypes carried by young children in Mongolia and the extent of the reduction in pneumonia following vaccine introduction. The reform government implemented national programs for healthy Mongolians and prevention of infectious diseases. In addition, a program to support the health of mothers and children was implemented in 2014. A common goal of all 3 programs was to reduce pneumonia, the second leading cause of death in children. Because it was a policy goal, I made the decision to implement these programs in Mongolia when I was working as a member of the government as the Minister of Health. I was working as the Vice Minister for Health in the reform government. At that time, the issue of the introduction of the PCV vaccine in Mongolia was presented to me, as I was the chair of the vaccine committee. There were some estimates regarding the reductions in child mortality if PCV vaccine was introduced for children in the country. However, there is a requirement to conduct a study prior to introduction of any new vaccine in the country. When introducing a new vaccine in our country, we conduct surveillance and research and introduce it in accordance with our country-specific data. In addition, a working group composed of ministerial experts and doctors working at the policy level is established, and several planned interventions are implemented. The PCV vaccine in Mongolia was introduced in a phased manner, in other words, first in 2 districts, followed by another 2 districts, and the results of the vaccine impact were compared. Our organization was tasked with performing calculations and generating the justification for introduction of new vaccines, including determining what percentage of pneumonia was caused by the pneumococcus, the clinical symptoms of pneumococcal pneumonia, and the appropriate measures to prevent or treat it. The original version of the PCV introduction policy document was developed by MCHC researchers in conjunction with researchers from other health agencies and delivered to the Ministry of Health. The policy document was discussed at the Mongolian National Immunization Technical Advisory Group meeting, headed by the academician Nyamdawa. It was discussed that about 20% of all respiratory disease in children in Mongolia was caused by the pneumococcus. It was therefore decided that it was very important to reduce this 20% to 0. There was therefore a need to extend and enhance the established WHO hospital-based pneumonia surveillance to collect research data to measure impact of PCV-13 vaccination in young children. World Health Organization's support was important in this. In addition, research methodology developed by the team at the Murdoch Children's Research Institute, MCRI, in Melbourne, Australia, provided an opportunity to study the impact of the PCV-13 vaccine on pneumococcal carriage in healthy children.
Дэлхийн эрүүл мэндийн байгууллага
WHO cooperated closely with the research team by providing technical and financial support before and during the implementation of the PCV study. Invasive bacterial disease surveillance was conducted in hospitals prior to the start of the study, and the data on invasive pneumonia among young children met the requirements of the study. The organized invasive bacterial disease surveillance provided the opportunity to collect and analyze data on invasive pneumonia among young children, in line with the needs of the study. WHO also contributed to the decision-making process of the Mongolian National Immunization Technical Advisory Group regarding the introduction of the pneumococcal vaccine. This contribution included an economic impact study, recommendations issued by the Strategic Advisory Group of WHO immunization experts to WHO member countries, and through sharing of the experiences, mistakes, challenges, and achievements of other countries. During the vaccine introduction phase, WHO provided support in a number of areas, including ensuring the readiness of the immunization system, capacity building of immunization program staff, providing training and information to the general population, and comparing the vaccinated and non-vaccinated population groups.
There are good reasons, actually, why Mongolia was selected for this project. At the time when we started, pneumococcal vaccine was already used in other parts of the world, and in fact, there was very little evidence from Asia of the impact of pneumococcal vaccine in the community, and particularly the ability of pneumococcal vaccine to prevent pneumonia in Asian children. In fact, there was a belief in some sectors that the pneumococcus organism was not an important pathogen in Asia. Around that time, though, we recognized that, firstly, Mongolia had a very significant problem with respiratory disease in young children, which of course is partly due to the climate and partly due to the problems of pollution. The Mongolian government was also interested and expressed interest in finding evidence to support pneumococcal vaccine introduction in Mongolia. My institute, the Murdoch Children's Research Institute in Melbourne, of the Royal Children's Hospital in Melbourne, is in fact one of the leading pediatric research institutes in the world and has a particular reputation for vaccine-related research. We have large programs in Fiji, in Vietnam, and we have been involved in quite a lot of studies that really prepare us quite well for this type of work. In addition, we have a very strong pneumococcal laboratory, arguably one of the best in the world. This really gave us the capacity to share that technology here in Mongolia and enable the Mongolian scientists to do a good job. So, this was an ideal situation to actually measure the impact of a pneumococcal vaccine in Mongolia.
So our team at MCRI focuses on applying really detailed microbiological methods that are used to generate data important for informing vaccine strategies across for Mongolia and across Asia.
The Surveillance Research Unit, Immunization Unit, Bacteriology, Virology, and Clinical Biochemistry laboratory teams of the National Center for Communicable Diseases, NCCD, cooperated to form an expanded surveillance study team for the PCV impact study. Children hospitalized with pneumonia in hospitals in 4 districts of Ulaanbaatar City, Bayansur, Songkhinherhan, Sukhbatar, and Chingalte district hospitals, and the Respiratory Pathology Department of the National Center for Maternal and Child Health were included in the study. The PCV-13 vaccine was introduced in a phased manner from 2016 in the country. Since 2015, to prevent pneumonia complications, the NCCD Clinical Biochemistry Laboratory, Bacteriology Laboratory, and the Immunization Team, together with WHO and MCRI in Melbourne, Australia, started a joint research program. An epidemiologist from the Songkhinherhan District Children's Hospital, working in the admission department, collaborates with the doctor who identifies children to be recruited in the study. In Songkhinherhan and Sukhbatar districts, children under 5 years old were introduced to PCV-13 for the first time. The main role of the epidemiologist was to be the main contact for the implementation of research activities in the hospital and to support and monitor study conduct according to the research standard operating procedures. Physicians and nurses collected data and laboratory samples from hospitalized children recruited in the study and completed study questionnaires. The epidemiologist used a study checklist to check whether any eligible children for the study had been missed and also checked whether the study questionnaire was completed correctly. Children's Department of the Bayan-Zirk District General Hospital. Chief Nurse Enktuya is speaking. Our nurse's name is Ganbatar Altantuya, and she has been working with us on the pediatric pneumonia surveillance program for 6 years. She has learnt a great deal. She just took a nasopharyngeal swab from a child named Undra. With regards to surveillance recruitment, the doctor identifies a child eligible for recruitment and obtains consent from the child's parents. After obtaining consent, a nasopharyngeal swab is taken according to the relevant standard operating procedure. The child's name, along with study ID, is recorded according to the code registration, and then the date and time of the sample collection are recorded. The nasopharyngeal swabs are sent to the National Center for Communicable Diseases Bacteriology Laboratory within 5 to 6 hours after collection from the child. The samples brought from the district hospitals are handed over to the NCCD laboratory in line with standard operating procedures. At our level, we prepare all nasopharyngeal swabs to send to the MCRI Microbiology Laboratory in Australia for analysis. Chingalti District General Hospital Radiology Department is taking chest X-rays for children. The most important thing is to take X-rays correctly, to produce quality images, and to read them correctly. When the Australian radiologists and technicians visited, they conducted on-the-job training on all X-ray procedures, including how to adjust the X-ray apparatus settings, how to keep the child still and take images, and how to document findings. During the study, the X-ray machine broke down and stopped working. The tube that emits the X-rays was burnt out. When the X-ray machine stopped working, the study team in Ulaanbaatar informed the MCRI team in Melbourne. The MCRI team agreed to pay the 24 million tugrik for the X-ray machine's spare parts and repairs to ensure that the X-ray machine worked for the rest of the study. National Center for Maternal and Child Health, Department of Respiratory Pathology. Nasopharyngeal swabs are placed in special transport medium to detect the pneumococci, and this testing is done using an expensive laboratory analysis technique. It was therefore our responsibility to select children who met the study criteria for inclusion in the study. As part of this work, swabs were taken and sent to the NCCD laboratory. Modern molecular testing was used in this study. Nasopharyngeal swabs were taken from hospitalized children with pneumonia, as well as healthy children. The collected nasopharyngeal swabs were aliquoted into 3 parts. 2 aliquots were sent to one of the 2 laboratories in the world who conduct this molecular testing, the Murdoch Children's Research Institute, MCRI, in Melbourne. At the MCRI laboratory, testing is conducted for pneumococcal detection, its serotypes and density of carriage. Detection of pneumococcal serotypes is carried out by molecular methods. Our laboratory received 15,694 nasopharyngeal swabs collected from enrolled children aged 2 to 59 months old. Before sending samples to the MCRI reference laboratory in Melbourne, we inspect, package, and prepare all samples for shipment. Nasopharyngeal swabs were transported daily from each of the 5 study hospitals to the National Center for Communicable Diseases Bacteriology Laboratory. One specimen was separated into 3 aliquots and stored with the original swab in a deep freezer at -80 degrees Celsius. Frozen specimens were shipped on dry ice to the Bacteriology Reference Laboratory at the Murdoch Children's Research Institute in Melbourne, Australia, for pneumococcal detection and serotyping. More than 15,000 specimens were collected over the 6 years of the research study. Each specimen was divided into 4 parts, with each specimen assigned a code and recorded prior to being shipped. An analysis of all blood samples to determine C-reactive protein and influenza and RSV detection on nasopharyngeal swabs were conducted at the Biochemistry and Virology laboratories of the National Center for Communicable Diseases, respectively.
It was obvious the Mongolian project team took a lot of pride in their work on this project, with all samples meeting the requirements for the laboratory in Melbourne. All samples were handled by experienced staff. They were all clearly labelled and accompanied by immaculate records. Transporting such a large number of samples was also a huge task. We did this in batches, with the team shipping samples on dry ice to MCRI. All samples arrived in really good condition. These shipments, though, weren't easy. The team in Mongolia worked extremely hard to get these off the ground, and I believe this process was made much easier by a great working relationship with our team at MCRI and also teams locally in Mongolia.
The study itself was conducted in 4 districts, and the introduction of vaccine was staged in different districts. That system allowed us to be comparing communities that were receiving the vaccine with communities that were not receiving the vaccine. That gave us the unique opportunity, really, to see the effectiveness of the vaccine in prevention of disease. This study design has been replicated elsewhere in the world, and people recognize that this is a very innovative way of measuring the impact of a pneumococcal vaccine.
And we saw that pneumococcal carriage was reduced in hospitalized children by about 44% at the end of the 6-year period. The reduction was much greater in younger children under 2 years of age. In addition to the pneumonia surveillance, we also had 3 cross-sectional carriage surveys in children that were done in the two districts of Ulaanbaatar, where the vaccine was introduced first. And these carriage surveys collected swabs from healthy children 5 to 8 weeks of age, as well as children 12 to 23 years of age who were eligible to receive the vaccine. Of the surveys, we did one in 2015, one in 2017, and one in 2022. And in the 2022 survey, we saw a 70% reduction in pneumococcal carriage in these children, which really shows the benefit of introducing the vaccine in this age group.
Which is commonly caused by the pneumococcus and viruses, is a leading cause of morbidity and hospitalization in young children. To reduce this disease burden, the 13-valent pneumococcal conjugate vaccine, PCV13, has been introduced for young children in the country. National Center for Communicable Diseases, Central Vaccine Warehouse. Dashbagam Otgunbayer, head of the immunization department, is speaking. Before the introduction of the 13-valent pneumococcal conjugate vaccine, pediatric hospital-based pneumonia surveillance was organized with a very large number of staff. Based on the surveillance results, a decision was taken to introduce the vaccine. During the study period, several ongoing evaluations, including the target population to be vaccinated and whether eligible children were fully vaccinated in a timely way, were conducted. These evaluations were supported through cooperation by both study teams in Ulaanbaatar and Melbourne, and the results were published in international journals. Also, in the first phase of vaccine introduction, the extended surveillance team worked together with the MCRI team to organize, publish, and develop information and promotional materials for doctors, medical professionals, and the public on a large scale. From the time of receipt of this vaccine, it is stored in the National Central Warehouse of Vaccine Bioproducts, and quality control for the vaccine is ensured by automatic controls on all equipment in the central warehouse. Temperature control checks are carried out daily in the morning and evening, and the vaccine is kept at a temperature of +2 to +8 degrees and distributed to rural areas. Study unit meeting at the Sukbatar District Hospital. Research activities to evaluate the direct and indirect effects of PCV vaccine given to children and to detect its herd immunity are 98% for children and 90% for adults.
The Adult Pneumonia Surveillance Project, which was the second component of the work that we did in Mongolia, had two components. We did a retrospective clinical data collection from January 2015 to February 2019, and then prospective data collection from March 2019 to February 2022. As well as collecting clinical data for the prospective component, we also collected nasopharyngeal swabs, urine, and chest x-rays in the adults.
Active and passive surveillance methods were used in both pediatric and adult research programs. Nasopharyngeal swabs and urine samples were collected from the recruited patients involved in the adult pneumonia surveillance program. The method of analyzing urine samples is unique, with antigens for pneumococci detected in the urine using the multiplex SSUAD method, which was developed by the Pfizer company in the United States. There are two multiplex SSUAD diagnostic tests used to process the study samples.
In addition, we are interested in the concept of herd immunity. In other words, the extent to which vaccine can protect people other than the children who are receiving the vaccine, for example, if the children in a family are vaccinated. We know if you can reduce the carriage of pneumococcus in the nasopharynx, then you can reduce the chances of that child passing on pneumococcus to other people in the community, and you can get that indirect measure of how effective the vaccine is in the community.
National Center for Communicable Diseases, Surveillance Rapid Management Unit, Extended Meeting for PCV Impact Study Team. All the samples are checked by the bacteriology laboratory according to the information received from the sites. At time of shipment, the completeness and packaging of the samples are rechecked with Dr. Bujin Liham from the PCV study team and handed over to her for the shipment. In this way, we avoid any problems when transporting the samples we have prepared overseas. The first results of the research study have been very successful. Out of the 4 research districts, Chingalte district did not have catch-up immunization, so the reduction of pneumonia in this district is very slow compared to the other 3 districts. In this study, we found that catch-up immunization is an important intervention at the time of introduction of a new vaccine in the national immunization schedule. We are pleased that the chest X-rays taken by us met the study requirements and were useful in confirming the diagnosis of pneumonia. We are pleased that the surveillance study trained our nurses to be more thorough and punctual. In this study that started in 2015, a team led by Professor Kim Mulholland from MCRI, Melbourne, Australia, visited the study hospitals in Mongolia several times to observe and assess surveillance activities and provide recommendations for improvements. In addition, the study team located at the NCCD in Ulaanbaatar visited our hospital every week to monitor the daily study activities. If the study team identified any activities not in line with the study's standard operating procedures, they would demonstrate the corrective action. This study was conducted according to a high standard thanks to the good cooperation of many people. Hello, I am a mother of 3 children. I regularly go to the family clinic for scheduled immunizations for my 3 children, as recommended by the doctor and nurse. I am very happy because my children are prevented and protected from contracting infectious diseases by getting the scheduled vaccines. My children have not had pneumonia since they received 3 doses of the pneumococcal conjugate vaccine before the age of 1 year. Thank you very much to the doctors, nurses, and health centers who safely immunize my children with the necessary vaccines, free of charge.
During the study implementation period, we have published more than 10 research articles in national and international research and scientific journals. Recently, we have published 2 research articles in the Lancet Western Pacific Journal, which publishes detailed and valuable research in the health field. We have also published our research articles 2 or 3 times in the Mongolian Journal of Epidemiology and made results available to the public. If we are to evaluate this international joint research, we can report impact at 3 levels. Firstly, at the law formulation and legal policy level, the study results have had direct and indirect impacts. Our country has an immunization law. Our national center has submitted a project proposal to the Ministry of Health to add 3 vaccines to the immunization schedule and to amend the immunization law. One of the 3 additional vaccines is the 13-valent pneumococcal conjugate vaccine. Our national center worked as the main implementing agency of this study. Secondly, our national center laboratories, such as the virology laboratory, bacteriology laboratory, as well as the clinical biochemical laboratory, have been strengthened because of the research activities. The protocols used in this study have also been incorporated into our national center. Thirdly, our surveillance department, including the immunization department, has made a key contribution in the scientific evaluation and evidence-based verification of the successful implementation of the new vaccine. The PCV impact study conducted in Mongolia can be considered a classic example of an evidence-based new vaccine introduction evaluation proposed by WHO Western Pacific Region. By sharing the results of this research with the world, it will become a good example for other countries that are similar to our country in terms of climate, economy, and development. The Mongolian government is currently funding this vaccine 100% from the state budget because Mongolia has provided real evidence that shows its benefit. I would like to thank the research team who worked closely with WHO, especially Professor Kim Mulholland from Melbourne and Dr. Tuya, the head of research on the Mongolian side. We would like to thank the team led by Professor Kim Mulholland, Murdoch Children's Research Institute, Melbourne, Australia, for jointly conducting this study, as well as WHO and Pfizer, USA, for their financial and technology support, and to the Ministry of Health, which supported the study at the policy level, to the research teams of Melbourne and the NCCD, led by Professor Kim Mulholland, Claire von Mollendorf, and Dr. Tuya, to the other health institutions that implemented it together, and to all those who participated, including children and their caregivers, as well as adults who actively participated in the study.